Welcome to the Cleveland Browns Virtual Parents Clinic. My name is Darrell Taylor, Youth Football Director for the Cleveland Browns. Today we have an impressive list of presenter and panelists to talk about athlete health and safety. At the end of the presentation today, all presenter will be able to field questions. Please use the Q&A portal below. Identify the speaker, then pose the question to the particular speaker. The Browns care about the community, athlete health, and safety, as evident through our Browns Give Back focus on educating youth football parents as well as coaches. There are no better advocates for a child's health and well-being than his or her parents. So we want to be sure you leave today with valuable information that will help you keep your kids safer when they play the sports they love. You will learn important heat and hydration and concussion information, hear about sudden cardiac arrest, as well as athletes' diet, and be instructed on proper tackling and blocking. Our first presenter today is Ms. Nicole Ward. She is the Executive Director of Make Them Know Your Name Foundation and the mother of Browns cornerback Denzel Ward. Welcome, Ms. Ward.
Thank you. Thank you for having me.
Thank you. Thank you very much. All right, to start off, could you tell us a little bit about yourself as well as the Make Them Know Your Name Foundation?
Sure. As you mentioned, my name's Nicole Ward. Born and raised here in Cleveland, Ohio. Proud mom of two sons, actually. My oldest son, his name is PJ, and as you mentioned, and as everyone know, my youngest son is Denzel Ward, who plays cornerback for the Cleveland Browns. As far as my professional career and background, prior to retiring, my background was in human resources for the first half of my career and then marketing for the second half. I have over 20 years of real estate investment experience, which I'm still very much involved in, and I am currently now a licensed realtor. And additionally, as you mentioned, I am the executive director of the Make Them Know Your Name Heart Health Foundation. So then I know you asked also to tell you a little bit about the foundation. So Make Them Know Your Name Heart Health Foundation is focused on bringing awareness to heart health issues, but also to bring awareness to the need to have defibrillators put into public spaces, and also for the public to be educated, knowledgeable, and willing to step up and use these defibrillators when faced with a life-threatening situation. Because what we're finding is that, and from personal experience, is that we have defibrillators in public spaces, but because of lack of knowledge or fear or whatever, awareness or whatever it may be, sometimes they're not being used, which ultimately could result in death. So we're just trying to bring more knowledge and awareness to that.
Awesome. It sounds like a phenomenal foundation. How can our parents and those who are watching get involved and know a little bit more about Make Them Know Their Name Foundation?
Oh, absolutely. I mean, if you visit our website, www.mtkyn.org, and MTKYN are the initials for Make Them Know Your Name. So that's probably the easiest way to remember that. So if you can visit our website, there's a lot of information there, and there's also information on how you can become involved if you're interested.
Awesome. Thank you very much for sharing that information. So as in regards to being a mother, what was it like being the mother of Denzel Ward growing up?
Oh, being the mother of Denzel Ward was a fun experience. Denzel, he was always a happy-go-lucky type of kid. And so very jovial. And also, at the same time, he's always been very competitive. Like losing was not an option for him. Like he always would do whatever he needed to do or whatever he had to do in order to win. So he's always been he always had a very competitive nature, very competitive spirit. So it was fun. He was also the type of kid that knew what he wanted. Like if it was something that he wanted to go after, he would do that. He would do whatever he had to do in order to obtain that. It's like no dream was too big. I just remember as a kid, a lot of kids say they're going to make it to the NFL or to the NBA. I remember reading a letter from Denzel when he was young saying that this was what he wanted to do. And then all as he was growing up, that's what he said. I'm like, Denzel, so what is the plan B? NFL. So I mean, it was out, like this is it, and I'm gonna make it work. And thank God he did.
That's phenomenal. Yeah, I've talked to his coach, Jeff Fox, over at Macedonia, and he said the same thing. Very competitive, a guy who knew what he wanted and he went after it. So that's great to hear it directly from you as well. Is there a difference between being Denzel's mom as a youth football player and now as an NFL player?
You know what? I am very, very close with both my sons. And the same with Denzel. I mean, I talk to both of them every day. And so for me personally, there absolutely is no difference than being a mom for Denzel as a youth athlete or at the NFL level. I am a mother first. And that's, that's just how it is. I feel like my role as a mother is to be there to guide him, to give him advice, and to protect him. I have the same worries, concerns, and things that were at the youth level as you do at the NFL level. So I would say no, that, at the end of the day, I am a mom, and that's how I try to remain, is in a mom's position.
Mom first. I love it. I
Yeah.
love it. As you mentioned, Denzel's mindset, he was 100% go. He wanted it. He sought after it. When he faced adversity as a football player, how did you talk to him or help him to overcome those obstacles?
Right. And, and he and we as a family, we have faced adversity, and then just general adversity throughout his career at youth and the NFL level. And I would have to say that my advice to him, and what I always try to remind Denzel, is that he is a child of God. And knowing that he is a child of God, there is nothing that will be placed upon him that he cannot handle. The other thing that I try to remind him of is what his father used to always tell him, and that was to make them know your name. So I remind him that he is a ward, and with the name Ward, we have high standards and high expectations. And what that means is that you work hard, you don't give up, and you go after what it is that you are trying to obtain. So I think with that just comes stand strong in our faith, and knowing that we do have high standards and expectations for ourselves within our family, I think helped to motivate him and to help him through the adversities that he faces.
Awesome. I love to hear that. And those principles can help us even if we don't have the last name Ward. I mean,
Yes.
absolutely. I love it. I love it. And so as Denzel played and your other son, did you volunteer for the youth football program? And if so, what capacity?
I didn't volunteer from the aspect of being on like a formal committee, but I was very involved in the aspect of if the team needed snacks, and we had days that we needed to bring snacks or refreshments for the other kids, we would participate that way. Volunteer in making sure that if there were programs, like youth programs outside of practice, or if they had banquets or award ceremony, to make sure that the boys were there and make sure that Denzel was there. And just volunteering my time as a parent, being present.
Absolutely.
Being present
Absolutely.
was also, a big commitment. I wasn't the type of parent, or we weren't the type of parents to just drop our kids off and then, come back once the game is over, or come back. If the youth practice allowed for us to be there, we would stay there and watch the practice. Whenever he had a game, we were at every game, cheering everyone on. We knew all the parents and the kids on the teams, and the parents and the kids on the teams knew us. So, I wouldn't say that it was a formal volunteer role, but still volunteering in other capacities.
I love it. I love it. Using your power to be able to give back to others and volunteer. And that's exactly what our organization is about with our First and 10 initiative, where we ask our community to give 10 hours a year to make the community a better place. And there's no better place than, being a football mom and being around the sport. There's always a need for volunteers. As you mentioned, to bring snacks, to hold chains during the game, coaching. So there's a plethora of ways that you can give back from youth football and just in general. So thank you for giving us those examples, and continue to be a leader in that space.
Absolutely.
And then the last question for you tonight: do you have any advice for parents watching tonight? I'm sure you went through the entire gamut from youth football all the way up to now being blessed to be a mother of a professional athlete. Do you have any advice for parents?
Sure. So my advice would be to stay active and involved in your child's athletic career, whether it's at the youth level, the NFL level, to be involved and to be present. Also, to stress the importance and set the expectations of maintaining good grades, to keep your grades at a high level, because if you want to play at a high level, you're going to have the GPA in order to do that. So education cannot be forgotten and is definitely important. And then I think my last piece of advice would be to remain a parent, no matter, at the end of the day, remain that person that your child can come to, can have a conversation, can release, can seek advice, no matter how well they play, no matter how big of a platform that they are able to obtain. I think, we still have to maintain that parent role. So my advice to parents to give to their kids would probably be to encourage them to work hard, but at the same time to remain humble.
Absolutely. Those are some great nuggets that you shared with us today from personal experience. And we really appreciate you taking time out of your busy schedule just to stop by and say a few words and to encourage parents to continue to be a parent first. And allow your kid to develop themselves athletically as well as academically. So thank you very much, Ms. Ward, and we'll see you hopefully this fall.
Great, thank you for having me. Bye-bye.
All right. Again, we'd like to thank Ms. Ward for taking her time to speak with us today. Our next speaker is Dr. Chris Bailey. He's going to talk to us today about heat and hydration as well as sudden cardiac arrest. Dr. Bailey is, no, I'm sorry, he's going to talk to us about concussions.
There you go. Very good.
All right. He directs the concussion management program at University Hospital, the neuropsychology section in UH's Neurological Institute, and is also the associate professor of neurology at Case Western Reserve School of Medicine. Please help us welcome Dr. Chris Bailey, who will share his screen and go over the concussion presentation.
Sure. Well, thank you for that introduction. So as he said, I'm actually, I run the concussion programs at UH, and I'm going to take a little time tonight to talk to you a little bit about concussion in sports. This is a really big topic. So this is something that we could spend a few days on and really not even, scratch the surface on. We're really just going to touch on a few things tonight. And what my plan is to just cover a few topics that I thought might complement some of the kinds of things that I know parents and coaches already learn through the different education that's required every year from Ohio and the other sports leagues that are out there. So again, we're just going to cover a few things, but just keep in mind there's just a whole lot more that we could be talking about when it comes to concussion. To start out with, let's just go over some kind of general stats about concussion. There's about 1.5 million concussions every year that make it into the emergency department in the U.S. alone. So that also is only about 1/3 to 1/2 of how many people probably actually get concussions. So we think that probably somewhere around 4 million concussions happen in the U.S. And only a very few number of them actually go out and get treatment for them. In fact, there was a study that was done in Canada that said that only about 10% of people ever follow up following a diagnosis of concussion with any kind of medical care at all. Concussion accounts for about 75% of all traumatic brain injury hospital visits. So traumatic brain injury is broken into 3 different kinds. There's the mild traumatic brain injury, which is also known as concussion. There's also then moderate and severe, and concussion accounts for about 75% of that whole spectrum. And then what we also know is that concussion costs the U.S. about $17 billion a year in medical care, lost productivity, and litigation. So it's certainly a very well-known and recognized public health risk. One of the things I also like to point out with people is that when we're talking about sports concussion, about 70% of sports concussions happen between the ages of 10 and 19. So though you hear a lot about professional athletes when we talk about concussion, there's been a whole lot of media attention with that, looking at professional athletes and outcomes and things like that. But really, when we're talking about sports concussion, who should we really be talking about? Really should be talking about our kids, because our kids are the ones who are the ones that get the vast majority of sports concussions. And in fact, the number of sports concussions over the years have increased some. And that sounds scary, but it's probably a good thing, because like I said, most people don't get any kind of management following concussion, or they don't follow up in any way. And the fact that we're seeing those increases is probably not because there's increases in the numbers of injuries, but what's probably happening is that there's more people that are having concussions that are actually getting help for them, which is a good thing. And just to look at the kinds of numbers that can occur, I thought I'd review some of the data from an article that was actually published last year. So this is looking at the numbers of concussions that occur in high school sports, and this is per 10,000 athlete exposure. So an athlete exposure is any kind of event where a person is in contact or at risk for having an injury. So that would be things like practices and games. So for every 10,000 practices and games, how many concussions do we expect to see? And what they found was that in football, there was about 10. So 10 in the 10,000 practices and games. If we're looking at other sports, women's soccer and men's hockey were the next ones up, around 8 in those. And then if we look at things like men's lacrosse, women's basketball, and wrestling, there's about 5. So 5 concussions per 10,000. Games and practices. Now, if we looked at things like Division I sports, we'd actually flip this a little bit. So wrestling would be the one that would have the most around, and they actually had the most, and then we'd have football and hockey being the next ones, and then women's soccer. And I always like to point out that, again, this is not just a football problem, right? So these are happening in all kinds of sports, especially team contact sports. Again, concussion is not a football problem, it's a sport problem. I also like to point out that the prevalence, the incidence of concussion is substantially less than the vast majority of other kinds of injuries that happen in sport. So if we're looking at things like musculoskeletal injury, sprains happen about 10 times as often. So in the same number, same 10,000 practices and games, we'd expect to see more than 100 ankle sprains that happen during that. And if we're looking at just pure numbers, so just the numbers of concussions that happen in the US every year in kids, something like bike accidents actually account for almost twice as many concussions as things like organized sport. So there's just some numbers to kind of be thinking about when we're talking about concussion. Well, what actually is a concussion? So here we are, again, talking about the kinds of information we know about prevalence and statistics about it. But a concussion, most of the time people think about the brain bouncing off the skull. That's probably not what happens in the vast majority of sports injury. Most of the time, what happens really is just some shaking. So there's force to the head or the body that makes the brain shake inside the skull. And then that shaking leads to some stretching and movement inside the brain that actually results in changes in function. So not the structure of the brain. So the look of the brain is exactly the same. So in fact, very few changes ever occur on things like CT or MRI, because those essentially just take a picture of the brain. They look at the structure of the brain. So only 4 or 5% of people will ever show changes on CT or MRI after having sustained a concussion. So most people don't. And again, that's because the changes that occur happen more in brain function. And it results in things like headache and dizziness and changes in mood and changes in vision and changes in your memory and confusion. So you get physical changes and cognitive changes and mood and affective changes, and those all tend to occur early on and can worsen over the first 24 to 48 hours. So what do we know about concussion recovery? One of the first things I always like to talk about when I talk to the patients that I see in my clinic is that they really need to know that it's not really a question of whether or not you're going to recover. It's a question of when. So when we're talking about a single injury like this, again, really everybody recovers. It's not really a question of whether, it's a question of when. And the when's going to vary pretty greatly from one person to the next. What the sports literature tells us is that we expect to see about 7 to 10 days of symptoms after a concussion before somebody fully recovers. In high school or younger, it can take a little longer, so more like 10 to 14 days. And there is a meaningful amount of individuals who are going to take a little longer than that. So 10 to 20% of people after they have a concussion are going to take a month or longer to recover. Rest is really the best medicine early on, but our understanding of rest after concussion is changing pretty dramatically. In fact, I'll talk about something in a second. But really, so again, when we're talking about rest, we're usually talking about days, maybe a week or so of rest after an injury. But most of the time, we're actually getting people active again a lot sooner than what we used to. And we're actually finding that people don't do very well if they rest too long. And probably, again, especially in sports, among the most important things that we want to do is we want to make sure you don't have a second concussion while you're still recovering from the first. So a lot of what we do as sports concussion providers is to be as confident as we can be that you have fully recovered from this concussion. So if you go back out and have another one, then you're going to recover from that one just as well as what you did this one. So a lot of what we do is, again, being as confident as we can be that you've recovered, and then to help facilitate recovery after a person's sustained injury. So like I said, we're involved in a lot of different research that's out there. And I would say that, there's actually more concussion research that's being done, that's actually been done in the last 20 years than ever before. So we know more about concussion now than we ever have. And we're still learning a whole lot, and there's still a lot to learn, actually. One of the things that we're doing at UH is we're collaborating with several people to look at a couple things. I'm just going to highlight 2 different projects that we're working on right now. One is to look at an intervention to try to help to facilitate recovery following concussion. We're calling that Recover Well. Actually, it's looking at exercise. So people that aren't recovering well, what we're looking for is we're trying to kind of turn management on its head, and we're making people kind of get more active earlier than what we thought. And we're looking to see whether or not that's helping to improve things. And the early results are telling us, and from other studies, saying that actually people do a little better if they're exercising and they're active, than especially athletes, than if they were not active. We're also trying to find something. There's not a lot of good tests out there that we can point to say that this person's had a concussion. We're looking at new ways of trying to identify that. I think we can do a better job. And so we're looking at blood-based biomarkers. So what would be great would be if we had even something like a diabetes-like stick test that somebody could get pulled from a game, they prick their finger, and we look at their blood, and it tells us, yes, you had a concussion, so now we know we need to pull you off. That would be a great thing to get. We're far off from that, but it would be something that we would like to try to get to. We're even looking at different kinds of imaging techniques, so different kinds of MRI-like things. So one that's known as diffusion tensor imaging is one that we're looking at as well. But we're collaborating with several different places to do that too. So like I said, there's a whole lot to learn about concussion. There's a whole lot that's out there. And I would also say this is one of those things I tell people not to Google very much. There's a lot of scary stuff. And a lot of stuff that's out there is just not all that accurate. This is our website. This is a place where you can get some trusted information. So, feel free to go there. There's actually some very specific things for parents and coaches to use that are at that website that talk about, how to identify a concussion. What can I do as a parent to help facilitate a recovery in my child if I'm concerned they've had a concussion? When do I need to be worried about trying to get them to the hospital? Those kinds of things. So feel free to look there. I recommend going there. And thanks for your time tonight.
Thank you very much, Dr. Bailey. Really appreciate you giving us that incredible information in regards to concussion. And a lot of the information that, like you said, is out there is not 100% accurate or true. So thank you for the resources as well. Without further ado, our next presenter will be Dr. Sean Cupp, who will be discussing heat and hydration as well as sudden cardiac arrest. He is the lead medical physician with the Cleveland Browns. He's also the assistant professor for the Division of Sports Medicine, Department of Orthopedic Surgery at Case Western Reserve University School of Medicine. and he's the co-director of Sports Medicine Institute at University Hospitals. So please welcome Dr. Sean Cupp. So we have Dr. Cupp will be sharing the screen here momentarily. Thank you for your patience. All right, looks like we might have some technical difficulties with Dr. Cupp, but if Katie Missick, she is another one of the presenters. So Katie is the Cleveland Browns performance dietitian. She's going to talk tonight about the importance of an athlete's diet. So please welcome Katie Missick to talk about athlete's diet.
Thank you, Darrell. I'm going to go ahead and share my screen so we can talk about athlete's diet. So as Darrell mentioned, I am the current dietitian for the Cleveland Browns. I'm entering in my 5th season with the team, and tonight I'm going to talk a little bit about the youth athlete's diet. So putting the pieces together, so where does nutrition fit in all of this? So you have a lot of the conditioning skills, you have the team skills, and you even have the mental performance. But in the core of that, how do you really improve all of the performance? And the right fueling strategies can kind of help overall kind of keep all of those skills intact and kind of help recover as well. So we're going to venture a little bit down that. So what is performance nutrition? So you want to get the most out of your training, and then we're going to have progressive improvement through strength and power. So football is definitely a strength and power sport. So how can we get the most out of that? And that's going to be through proper training and through proper nutrition. So the next level prep, to be ahead of the competition, you always want to prep for the next level. And that next level usually comes with what is your opponent not doing, or what is that person in that starting spot that your child is vying for? What are they doing and not doing? And that might be nutrition. So we want to focus on all the little things that will add up to one big thing to kind of make that improvement. So getting the competitive edge, that nutrition and that improvement in their diet can definitely be that secret weapon. Prior to being with the Browns, I was at Florida State and a couple other universities prior to that. And we always wanted to kind of outdo the competition in any way we could. And that usually were all the little things like nutrition. So nutrition can improve energy and focus and sharpen those skills. So those sharper skills are going to increase the scoring power. And we definitely want to do that because at the end of the game, whoever has those more points it's going to be the winner. So fuel. So especially with back-to-back games and people that are in tournaments and practices and homework, we want to make sure that you have enough fuel in your tank to do that. And what kind of fuel is it? Recover faster, less muscle soreness, and then fresher legs. So this is real big here at the Browns, as well as at the collegiate level, at the high school level, and even down to the youth level. You want to make sure that they have enough energy that helps them recover faster. So the basis of our diet are these foundation nutrients. We have 3 macronutrients that all provide calories, and they all have a certain function. So the first one is protein. It is a vital part of the athlete's diet. It's going to help us grow, repair, and maintain everything that's going on with our bodies. It supports strong bones, muscles, and ligaments. It helps us keep a healthy weight. It definitely provides important function with our immunity and healing responses, as well as reducing soreness post-exercise. And this is also big post-weights, post-conditioning, post-game, and post-practice. Carbohydrates. So our carbs are the main fuel source of our muscles. There's a lot of stuff out there, just kind of like Dr. Bailey said, of Googling, and carbs are our friend and they're our main fuel source. They're like the gas for the car. This is the quickest energy source, and it's stored in muscles, so we're able to tap this really quickly to kind of get that power and that quick jolt of energy that we need as football athletes. This is also the construction crew for the protein. So you got to have a little bit of both to help repair. The protein can't get in the muscles without its energy source or its construction crew, and that's the carbs. So not enough carbohydrates can also negatively affect performance, and not to mention things outside of the sport. So homework, again, that focus, that attention span, all of those necessary things throughout life can be negatively affected by not enough carbohydrates. And then the third macronutrient is fats. So there are 4 vitamins that we need a source of fat to help absorb and work in our body. And those are vitamins A, E, D, and K. So too little fat can also decrease energy and weaken the immune system. It does provide long-lasting fuel for training. So this is usually over an hour of training. This is really useful in marathoners and longer activities itself. And then omega-3 fatty acids, things you find in nuts and seeds and fish, these are healthy inflammation relief fats. So definitely a good source to kind of add in, especially at our level here at the Browns. So we have these things called performance plates, and it's kind of what I help the players do on a day-to-day basis, is kind of coach them through this. On an easy day, we're going to have half of our plate be fruits and vegetables, and then a quarter be that carbohydrates and proteins. On the moderate days, you're going to kind of scoop it up a little bit and have more of a third, and a third, and this is going to be exercise between 1 and 3 hours. And then on a hard day, we're going to have mostly carbohydrates. And this is to kind of make sure we're fueled and make sure we have enough energy source to recover. And that protein in those fruits and vegetables are going to have its own functions to kind of work with in the body. So it's really important to kind of make sure that every athlete is getting enough in the proper amount for each type of day. So hydration, we might hear a little bit throughout the day or throughout this presentation, but what can we do with hydration? And this is kind of, we call this H2O, and we want to make sure this is that fourth macronutrient and fourth importance. We're going to drink fluids throughout the day and all day. Just a reminder that sweat is just not fluid. It also is electrolytes. So sodium, potassium, calcium, and magnesium. A sports drink may be warranted, but not always. So again, it usually depends on how hot it is. Was it lasting over an hour? And how hard did the athlete actually work? So those 3 H's. We want to focus on mostly water and sports drinks as necessary, and limit those sugary sweetened beverages, sodas, and definitely try to avoid soda on game day. We also want to try it as a youth athlete, avoid energy drinks and highly caffeinated beverages. And it's also important to remember not to confuse energy from caffeine with energy from food. They're definitely not the same thing. So what are some hydration strategies? So we want to look at about drinking about 1/2 to 1 ounce per pound of body weight per day. So some of our linemen weigh about 300 pounds. So we're going to try to encourage them to drink 150 ounces of water a day. So that's a gallon and an extra 30 ounces. So that's a lot of water, plus what they lose on the practice field. So you guys can kind of take that and use that for your athlete, and definitely make sure that they're carrying a water bottle throughout the day at school. And we can kind of make sure we stay in a hydrated state. We can improve our performance about 2%. And again, it's another one of those cutting edge strategies. If you take a look at this urine color chart, this is kind of an easy way to detect whether or not your athlete is hydrated. So I always kind of say we want lemonade colored urine and not apple juice colored urine. Now, if your athlete is taking some multivitamins, they might have a little bit of a brighter colored yellow. So we just kind of take that into consideration when they're looking at their color of their urine. But it's also a quick, easy guide to kind of use. So eating to compete, and what does it look like when you're on a game day? So usually about 4 hours before a game day, we have that pregame meal. And you guys can kind of see what the meal options would be, like 2 chicken soft tacos on a corn tortilla, that healthy fat from the guacamole, salsa, and some water. About 2 hours before, we're going to have a small meal and some liquids, again, trying to make sure that it's low in fat and low in fiber so it doesn't upset the stomach. And then an hour before, we're just going to top off the fuel stores a little bit because they've had some pre-workout warm-ups. They might have had some stretching. So we want to have, again, low in fiber, low in fat, and easy to digest. So that might be that sports drink, graham crackers, a banana, an English muffin, or anything along those lines that don't really have that fiber or fat in the way for digestion. Just a quick, easy top off the fuel stores. And then an early morning game breakfast. If this is something where your athlete has like a 9 or 10 o'clock game and it's really hard to get them up that 4 hours before, again, you want it to kind of mimic that 1 hour before. So something with like a smoothie with fruit and milk, a carnation instant breakfast always works pretty well. And a lot of fluid, and then maybe some oatmeal with bananas or blueberries. It doesn't have to be really big when you have that early morning breakfast, but make sure that they are eating after their workouts. So we talk a lot about at this stage of fueling about timing is key. So you guys can kind of see if that poorly fueled athlete, if they're just eating 2 times a day, they have these huge spikes in their blood sugar, and we really want to kind of even that out. So we want to try to get them to eat as frequently as possible, around 2 to 3 hours. And I know that's extremely hard when they're going to school on their own, and how can we kind of really work around that timing. But this is kind of what we work on here in our building at our facility, is having about these mini meals or 3 meals and 3 snacks. And it really kind of helps stabilize their energy as well as kind of maintain their metabolism as an older athlete. So what does an example day look like? And this is kind of what we would go along here at the Browns if we had an afternoon practice. So you guys can kind of see that 6:30 a.m. breakfast followed by a snack. We're going to go with that 11:30 breakfast would be that actually be lunch. We would have a pre-practice snack. We would have practice. This refueling snack is kind of in the middle of that to make sure that they have enough energy to maintain that. And sometimes it's not feasible to do during some practices. We have some breaks during our practices, which allows me to kind of make sure anybody that needs something is able to get something. As they're walking off the field, we want to make sure that they replenish what they put out on the field. So that's going to be carbohydrates, which is fuel. They broke down their muscle a little bit and they lost fluid. So something along these lines would be a chocolate milk or a protein shake to get all 3 of those back. And then ideally, we would finish the day out with a dinner, and then we would have a 9 p.m. snack. So that is a lot of eating throughout the day, and that's kind of how we kind of mimic that here as best as we can. So recovery strategies, this again is really important at any level. So we're taking in nutrition between 30 and 60 minutes after exercise. This is going to help refuel muscles with carbohydrates, especially if you have another practice or game or workout within the next 8 hours. So you guys can kind of see how many grams of carbohydrates an athlete might need. And usually what we kind of work off of is 15 grams would be about a slice of bread, or 20 grams would be about a slice of bread. So you guys can kind of use that as a gauge for that refueling example. So we're repairing muscle. Repairing and rebuilding muscle takes in about 20 to 30 grams of protein. And we kind of think about that as like a scoop of protein or about eight ounces or a cup of fluid cow's milk. And if you have a low appetite or your athlete has a low appetite after exercise, a liquid option is usually better, just because they don't feel like chewing, drinking may just be a better option. We're also going to rehydrate. We kind of talked about putting all 3 of those back in. And again, if it's a smoothie, you have that liquid in there, but they also may need to drink some water or a sports drink, depending how long that practice was. And then rest. So teenagers need a little bit more sleep than we think. So we want to aim for 8 to 10 hours. And I know that that's kind of pushing it, and we kind of push our athletes here to get that 8 to 10 hours as well. And one statistic is that athletes who sleep under 8 hours have about 1.7 times greater risk of injury. And we want to kind of make sure that they have enough time to repair all of their energy needs in their body during that time. So this rapid recovery, we want to have fluid, carbohydrates, and protein. We kind of talked about that. And that recovery window is even more important with multiple workouts in one day. And colleges and NFL, we don't really do 2 days any often, but our days are long, and we might have a walkthrough and a practice. And sometimes those can be a workout too, depending on what position you play. So we want to make sure that with that recovery window, we really take that and we use it to our benefit to kind of have all of these components within our recovery. So supplements and fad diets, I get a lot of questions about this on a daily basis, and this can be its own presentation within itself. But I just kind of want a couple quick reminders. Supplements and fad diets are neither appropriate for youth or teen athletes unless directed by a physician. Before trying any other supplement or diet, just look at the overall quality of the diet prior to experimenting with a restrictive diet. Is the diet consisting of pizza, hamburger, French fries, and soda, or is it salmon, brown rice, and steamed broccoli? So at that quality, we might want to kind of make some changes towards that better quality without really diving into a restrictive fad diet. And just a reminder that cutting out any food group can lead to nutrient deficiencies and put any athlete at risk for illness or injuries. We want to make sure that we keep all of those food groups intact. A little bit along the lines of supplements. So supplements are studied on adult athletes and really not appropriate for use until at least 18 years of age, or again, directed by a physician. So just really be mindful that all supplements are not FDA approved and they're on the shelf till something bad happens. So pre-workouts, post-workouts, even some protein powders can be misleading with their labels, and they're not, a lot of times those labels don't necessarily match the contents of those supplements. So we want to make sure that we really focus on whole foods first, and then we supplement as needed if needed. So kind of just a little review to sum up is focus on filling up on balanced meals, use those performance plates, focus on hydrating throughout the day and before, during, and after training or competition. So start with a breakfast. Just a quick little stat that 40% of high school students do not eat breakfast. So it's really important to kind of start every day with breakfast. Think smart about protein. Should be a part every meal and every snack. I always kind of say the carbs and proteins go together like shirt and shorts. You got to have one, you got to have the other. So make sure that they always go together. Athletes should always eat often. Do not skip meals and pack snacks. So this is something we've worked on with some of our athletes here, that if they're traveling, they're putting snacks in their backpack. So it's really, really important to kind of make sure you're prepared. And then recovering with proper nutrition 30 to 60 minutes post-exercise. And again, exercise is weight training, conditioning, practice, or even a game. And that is the youth athlete's diet.
Thank you very, very much, Katie. That was a lot of great information, a lot of information that I did not know, especially being a former high school and collegiate athlete. I think I might have did a little bit better if I had better nutrition. So thank you for that information. Really appreciate it. And next up, we have Dr. Cup. So we had a little technical difficulties, but Dr. Cup should be ready to go now. He'll share his screen and we'll have a presentation on heat and hydration as well as sudden cardiac arrest.
Can you hear me, Darrell?
Yes, sir.
Yeah, I'm still having trouble getting my screen to share. Here we go. Can you see it now?
Yes, sir.
All right.
All right.
Are we live? We're going.
Good to go.
All right. Thanks, Katie. Thanks for stepping up. Technical difficulties on my end. So, Darrell, thanks for having me again this year. Appreciate talking to the parents anytime that I can. We're going to open up my conversation about heat and hydration. We're going to start out with heat illness. So I want everyone to think of this as a continuum of a heat problem, going from very mild as cramps to syncope, which is passing out, and then an exhaustion, which is a moderate level of heat problems, and then heat stroke. And that's what we really worry about, because that oftentimes can lead to death. And what is this affected by? Well, its frequency is brought about high humidity, high air temperatures, and high radiant heat. And there's an equation that we use in the medical field and the athletic training field that determines what's called the wet bulb globe temperature. And you can see that equation at the bottom of the screen right now. What's the most important variable for that is the relative humidity. So it's 7 times more influential than any kind of heat stress in the air temperature. And it's, this is very variable, and it's something that we always want to consider when we're trying to determine the safety level of practice. And you can see there onto the right of the screen what the wet bulb globe temperature reading gives us. Whenever it's over 92, there can be no outdoor workouts. You want to cancel exercises, all the way up to 82, which is normal activities. And we have different levels in between. So everyone is pretty common with heat cramps. Most people that have done anything athletic usually have developed heat cramps at some time. And how do we define them? They're painful involuntary muscle contractions. They usually happen during a prolonged exercise or after. What causes them? We really don't know. There's a lot of theories out there. Probably the most consensus agreement is that this is usually a salt imbalance within our blood and muscle, and due to fluid and water loss during the activity with sweat and urination. And see here, the middle column here, this is some description of what to expect with heat cramps. And in this particular slide is a comparison between heat cramps and exertional sickling. But if you look in the middle, what is the pain factor of heat cramps? It's very excruciating. They can very well pinpoint the location. The muscle often locks up. It looks rock hard. Oftentimes with our professional and college level football players, their calf muscle or abdominal muscle or quad muscle will lock up completely and look like they're just flexing really hard. And it gets very painful. They'll yell in pain. They'll move around, and they get a prodrome of some twinges beforehand. And this can occur, during or after a very intense workout, usually 30 minutes or longer. And what happens is the body's core temperature does elevate, and that leads to part of the physical process that leads to the cramping. Our next level is syncope, and that's when we pass out. You want to look for these certain symptoms with our athletes when we're worried about heat syncope. Do they get lightheaded? Do they feel weak? They're complaining of tunnel vision. They have pale and sweaty skin. They get dizzy and even can lose consciousness. And then there's a progression into heat exhaustion, which is a more worrisome heat issue. And that is truly when there is a strain on our body's vascular system to maintain a normal body temperature. The body wants to regulate temperature, get rid of heat, and try to cool itself as best that it can. And whenever that is to a breaking point, the body gets stressed out and true exhaustion takes place. What are some of the symptoms? You can see on the screen: fatigue, weakness, nausea, vomiting. They can even report chills. They look pale. They can have a headache. They can start hyperventilating, getting really dizzy. Two of the physiological parameters that we really look for is decreased blood pressure, and we also monitor their body temperature. It can elevate up to 140 degrees and still be called heat exhaustion. Once it gets into 105 or higher, that's when we give it the title of heat stroke. And that's going to be our next level. This is the most severe illness that we worry about. This often can lead to death when not taken care of appropriately. So what happens here? As I mentioned, our body's ability to regulate temperature goes haywire. It completely stops. We produce more heat than we're able to get rid of. Our core body temperature elevates over 104.5. Classically, it's usually in environments where there's really no access to any cooling techniques. The body usually, as I mentioned earlier, this is a continuum. The body usually goes from the cramping up to exhaustion, then to a heat stroke. And as we try to do cooling methods along the way, the body fails to respond to this. And what happens to our cardiovascular system, our heart starts racing really fast, the tachycardia. We start breathing really, really quickly, trying to blow off as much heat through the respiratory mechanism. Our blood pressure drops, we pass out, and we no longer have the ability to cool ourselves through the sweating mechanism. And that's very ominous and often is a sign of impending doom. What are some of the brain changes that happen in our central nervous system? Well, we can get irritable, confused, dizzy. Sometimes there's a really aggressive behavior by the athlete. They can get nauseous and vomit. They can even go on to develop seizures and then become unconscious. What are some of the risk factors for this? Low levels of fitness, being dehydrated, obesity is a risk factor. Any type of recent heat illness or febrile illness, that's why we're always concerned about someone who's had a cold or strep throat or something like that, being able to play, especially in a hot environment. Those people who haven't acclimatized very well. And we also worry about medications. Often kids are on antihistamines and even ADHD drugs. I know I have 3 children, and one of my children are on ADHD medication, and it's something that I have to review with him and with his team, that he's got to be more aware of his response to heat because he's on this medication. And what's treatment for heat stroke? Well, definitely you want to immediately stop the activity. You want to start cooling the body. Water immersion is best, getting the body inside the cool water as much as possible. You want to get towels, soak them with the icy water, put them around the body, put them over the head. Make sure you do this in a shaded environment, and you want to start replacing fluids. Now, it's best if they can take them by mouth. If they can't replace by mouth, oftentimes we'll give an IV, but usually we cool the body first before we start an IV, at least on site at a sporting arena. You want to avoid any exertional activities for 2 days following. You want to avoid anything like acetaminophen, the antipyretics, and definitely, this is an old wives' tale using alcohol baths. But the most important thing is to seek medical care. This is a picture of a rapid cooling tub. We have these with the Browns. We have these at the college level. Many of the high schools that UH takes care of. We have over 45 high schools. We help them get tubs for their football and early fall training facilities. And you want to cool the body until the core temperature reaches 101, 102, because they're usually over 105 when they have a heat stroke. You want to bring the body temperature down, and a lot of times they'll start to shiver. And the most important thing is you do not transport or allow transport of the injured athlete until their temperature is down below 102 degrees. You've heard of people dying in transport on an ambulance. This is what happens is whenever they don't get cooled before they get in the rig and head to the hospital. You definitely want to transport them to the ambulance or to the hospital via an ambulance. So let's talk about prevention. What can we do to prevent this? Well, as I mentioned earlier, acclimatize the body. Back whenever I played, we didn't have this. You had 2-a-days Now we're a lot wiser as we get ready for football camp. There's a slow progression of about 10 to 14 days where the kids go out just in jerseys with helmets, jerseys with shoulder pads before they go to a full day. So you want to gradually progress them into the environment with their equipment. You definitely want them to wear light-colored, lightweight equipment early on. As I mentioned earlier, be very cautious with the people who are taking antihistamines like Allegra, Claritin, things like that. You know, we've had a really interesting spring with a lot of rain, and we had a really mild winter, and so everyone's allergies in Cleveland are really bad all throughout the summer and right now. So a lot of people are on antihistamines, and that may continue into the fall. And as I mentioned, the ADHD medications, those are the two biggies with our kids. You definitely want to monitor temperatures and plan for activities. I mentioned the wet bulb globe temperature. And as Katie mentioned about hydration, what I really like to use the word is pre-hydrate, and to get these kids ready beforehand. So these are the minimum amount of drink that they should have: 8 ounces 2 hours before the exercise, an additional 8 ounces 30 minutes before, and then 12 to 24 ounces of replacement for every hour. And as Katie mentioned, you know, our recommendations is not a sports drink unless you have an activity for longer than 1 hour. So an hour or less, water is really the best replacement. And as Katie also showed you, this is a urine chart that we give the athletes, and this is one of the best things that at any level people can figure out. They can see their urine, they can tell, am I hydrated? As I always tell the athletes, is you want to make sure your urine is the color of really weak, bad tasting lemonade or even clear. But if it gets dark, as bad as Mountain Dew or tea, then you're really in trouble and you're far behind, and you're going to have to probably sit out until you get hydrated enough, or you're going to have some true medical issues. So again, in summary, prevention of a heat stroke, hydration is very important, both during, before, and after exercise. Fluids are very important, especially with heavy sweaters. Having the ability to cool the body, you want to have a good plan. You want to have good work to rest ratios and give people plenty of time for their body to recover. You want to acclimatize, as we mentioned, and you want to educate not only the players and the parents, but the coaches and all the medical personnel that are involved with the team. Another slide on hydration. Again, 1 to 2% of the body weight can be lost and cause a negative performance for an athlete. I highlighted here, be aware of salty sweaters. So the athletes who get the caked on salt on their shirts or on their cheek, and they drink water, they can feel it. Those are the salty sweaters. Those are the ones that can cramp up easier and also have some of these heat illnesses a lot sooner than someone else. And I always think of salty sweaters as your running backs, your linebackers, guys who are quick, muscle twitch, kind of at maximum speed. And those are the guys that you really want to watch out. Those are the ones that may do better with some type of salt replacement sooner rather than later. So some type of sports drink may be more beneficial than water for those individuals when they're exercising for less than an hour. Again, the hydrate before, during, and after, up 8 to 16 ounces 2 hours before the activity. This is just another summary slide of what we mentioned before. Again, summary slide of the treatment for heat stroke. Awareness and communication are probably the most crucial. You want to rapidly cool, then transport. I can't stress that enough. Whenever we have meetings with our EMTs, both at the high school level, the college level, and professional level, they all know that the most important thing is that we cool this athlete before we transport them to the hospital, because they will cook in the rig, and we don't want that to happen. We want to reduce the body temperature as fast as we can back to a normal physiological state, and water immersion is probably the best way to do that to lower the core body temperature. Some of the resources for heat illnesses: the Core Stringer Institute I have up here, and also the USA Heads Up Football, two wonderful resources for you guys to look at. Some additional resources here I've listed. The OSA website, the Ohio High School Athletic Association sports medicine page. So moving on to sudden cardiac arrest in athletes. So what is this? So sudden cardiac arrest occurs when the heart stops suddenly and unexpectedly, and that prevents blood from flowing to all of our vital organs, especially the brain, our liver, our stomach, everything. And most people that have sudden cardiac arrest will die if they're not treated immediately. Well, what can this be caused by? Well, I think of the heart often, as I explain this to patients and athletes, is that there's a plumbing issue with the heart, so a structural issue. There's also an electrical portion of the heart. And so the heartbeat is electrically controlled. And so there can be a structural problem with the heart, and there can be an electrical problem with the heart. And a third type is that there can be an infection around the heart or to the heart muscle, or even trauma to the heart. And what are the warning signs for sudden cardiac arrest? Well, these are questions that are on the pre-participation examination physical form that your kids fill out every year. And these are very important questions for us as physicians as we screen your children for these medical problems. But having a family member who suddenly died before the age of 50 is a very high risk. And other specific heart problems, including a cardiomyopathy, which is a problem with the muscle of the heart. A lot of times it can be an infection or a medical problem. A long QT symptom, which is an example of an electrical problem of the heart. And then Marfan syndrome, which one of the manifestations is a structural problem of the heart. And then any of the other various rhythm problems of the heart are also worrisome for someone developing sudden cardiac arrest. So what are the symptoms that we can look for in our young athletes? Well, if they're exercising and they have any of these that I've listed, chest pain, discomfort, unexplained fainting or near fainting, the syncope, any dizziness, any unexplained tiredness, shortness of breath as compared to the other teammates and athletes they're training with, or an unusually fast or irregular heartbeat are all symptoms that we worry about when we want to pull the athlete. So that says, what happens if anyone experiences these? Well, the coach must remove the athlete immediately, and the athlete must be seen and cleared by a healthcare provider before they can return to any sporting activity, and they must have written clearance to bring to the school. Again, what happens if the athlete experiences any of those warning signs or any other warning signs? They definitely need to see a healthcare professional. Well, who is that healthcare professional who can evaluate and clear the athlete? So any physician, a medical doctor or an osteopathic doctor, certified nurse practitioner, or physician assistants who works with one of the physicians or a clinical nurse specialist are all allowed in this state to clear the athlete after a thorough evaluation. What is needed for the athlete to the return? They definitely have to have a clearance form in writing from the healthcare provider. And that has to be given to the coach and to the school athletic trainer or another school official to show that the player has actually gone through everything they need from both a legal and a medical standpoint. In Ohio, this is called Lindsay's Law. It was established in 2017, and that is where the athlete and the parents and the guardians have to follow certain educational protocols regarding sudden cardiac arrest. So what's Lindsay's Law? Well, as I mentioned in 2017, former, I think she was the Miss Ohio, this was her platform that she introduced to help improve healthcare of young athletes. And it covers anyone 19 years old or younger in any type of organized school or youth sports organization. And there's a handout that the parents and the students have to review, and a video they have to review every year and sign off on. And this is a requirement in all schools in Ohio, public and non-public. Any type of club or youth sports organization all the way down to cheerleading and club sports. That's all I have, Darrell.
All right, thank you very, very much, Dr. Cup. Really appreciate you sharing that information on heat and hydration, as well as sudden cardiac arrest. So we're gonna take a little break here, and we're going to have some dialogue between us. So if you could use the chat function below and let us know what youth football program your son or daughter plays in. So type in the chat, utilizing the chat function to let us know what youth football program your son or daughter plays in. As well as we're going to ask a question: does your youth football program have a working AED? So if everyone can answer that question, this is important in regards to sudden cardiac arrest, to verify if your son or daughter's program has a verified AED. So we still have some time left. Okay. And also remember to utilize the chat function. Right after these questions, we will have Bo Rugg from the OHSAA, who will be talking about return to play with Ohio High School Athletic Association. So far, majority of the youth football programs have AEDs. Nice. Also, remember to use the chat function to let us know what youth football program your son or daughter plays. We have Next Level Athletics and Warren City School Raiders. CYO. Great to hear. St. Chris Lakewood Catholic Academy. Thank you very much for your participation. All right, we will close the poll. So it's great to hear that 83% of our parents' programs have AED. That's great to hear in regard to sudden cardiac arrest. So our Nordonia Youth Football, awesome. So our next presenter will be Bo Rugg from the Ohio High School Athletic Association. Bo is the Senior Director of Officiating and Sport Management. He's the football administrator for the OHSAA. So please welcome Bo Rugg as he talks about return to play from an OHSAA standpoint.
Thank you, Darrell. If I can figure out again how to share my screen, I will do it. Oh, there it is. Okay. A couple things we'll talk about. During this pandemic, it's been a crazy 3 months, as everybody knows. And what we have tried to do is plan. Our executive director says, hope for the best and plan for the worst. And let's talk a little bit about how we got here. I was actually standing on the floor of St. John Arena during the girls basketball tournament, getting ready to get started in our first game, and we indefinitely postponed our tournaments. The interesting thing about that was we had no idea at that point what our duration would be, and so we weren't even thinking about anything but winter. And then we went into canceling winter tournaments and postponing spring sports, and all of a sudden we were looking at 3 or 4 different scenarios on when could we get students back participating in sports. And obviously we're dovetailing this in with can we get students back to school at that point. And when we couldn't do any of those things, we looked at when schools were basically canceled as far as going back to school in schools for the rest of the year. We started looking at what does summer look like and what does fall look like as we progress through this. And we lost all of spring, our end of winter, all of spring, and in summer, all of our sports football included, have time where our coaches work with our athletes in the summer. And so our regulations, how did they fit in with what was coming from the governor's office in returning to play? And so we have to kind of adjust and react to what the governor has and what the governor says we can and can't do as it relates to being out and about, reopening the state. And reopening sports is a part of that. So what we looked at is the first thing that happened was in, I think it was May 26th, what was called basically non or low contact sports could start some practicing, and other sports like football, lacrosse, basketball, soccer, anything that that the people really come together during the sport, could do some skill training. And they could do skill training on in pods, and as long as they social distanced. And so what we did with our member schools is send out some guidelines of what they could do in different phases and how they could get started to get back into participating in some way, shape, or form. And that worked very well for most of the month of June. And on June 22nd, just this past Monday, all of those sports, those contact or semi-contact sports, were allowed to come together and work with each other, and that fit within our regulations. Football is one where we don't have contact football outside the season in high school football. So what they can do is they can work together at 7-on-7s. They can wear helmets, but not shoulder pads or other pads. And really, June 22nd put us back into that type of scenario where we could actually, coaches could work with all of their athletes in football, and we could get to practicing in that mode, so to speak. So when all of that has happened, we have to get to the next step. And what is the next step for football as far as high school football is concerned in the summer? The next step in the summer is being able to play 7-on-7 against other schools. That we have a lot of schools, usually in the summer, we have a lot of big 7-on-7 tournaments where even the Ohio Coaches Association usually has a huge one in early June that has, I think, 60 or 70 schools that participate, and it's a great day of 7-on-7 and some lineman challenge stuff and different things that we've lost. And so when can we get back to doing some 7-on-7 against other schools that helps us prepare for when we start practice in what we call the fall, but it's actually August 1st. And so we think that's going to come within the next 2 weeks, probably week. And how does that come? It comes from the governor, where the governor says in these types of sports, and it includes basketball, it includes soccer, it includes others as football, that you can practice against other schools. You can have contests, so to speak. That's how they say contests and scrimmages. That's a different term for us, especially in football, in that we are not playing contact football right now. So when that happens, we'll be back to what we would call pretty much normal summer mode. And that will probably only last for a couple of weeks, because we are on track right now to start practice when we always start practice in football, high school football in Ohio, August 1st. And if we do that, then we will be on schedule. What can affect that? Certainly anything coming from the governor's office that reins in what we're doing. We have to communicate very well with the governor's office on this, the Ohio Department of Health. Each of our member schools, and there's 830 of them, in their area needs to consult with their local health department. And they may have restrictions that they may not start as early as others because of what's happening in their area. And that's happened throughout the summer. It may happen August 1st. We have to communicate with the state superintendent to find out, are there schools that aren't going to have students coming back to their schools? And if they don't have students coming back to their schools, how does that affect extracurricular activity? And that's a big part of getting back and playing football, soccer, golf, everything in as far as school sports are concerned. And so those are the types of things that could alter the plan going forward. A couple of things that if we go forward on August 1st, and that's where we're looking at right now, what type of restrictions will be out there and will be encompassing what we're doing in football. We've gotten a lot of information from the National Federation of High School Sports. We've certainly gotten a lot of information from our Sports Medicine Advisory Committee and others on how we want to look at practice and then contests moving forward. A couple of things that we know that will happen if you are not participating on the field or court or whatever sport it is, and you are outside on the sidelines, you need to be distancing yourself. And so that's going to probably create some rule modifications in football and spreading out the sideline to give people a lot more room. As far as people on the field, we have already approved different things that are out there. There's face masks out there with shields that are approved to use. They will not be required, but they may be used. And we have a lot of different people that we have to think about as it relates to on the field of football. We have all the players we're thinking about. We have the coaches we're thinking about. We have the officials we're thinking about during contests, and they all interact. They interact prior to the contest and after, and there'll be rule modifications to make sure we're not congregating as we have in the past. And those are the things that we're really kind of dotting the I's and crossing the T's on how we're going to do those things moving forward. And we have to be flexible because we could get information coming from the Ohio Department of Health and from our member schools and from the governor's office that changes what we do. And a lot of things are on the table. Could we have a shortened season? Could we have a shortened season with more people playing in our tournament? Could we have the same season in our tournament? And what's it going to be like when somebody tests positive to COVID during the season and for that team? And can they not compete for 2 weeks? And so all of those things will have to be in order for us to continue the season. The good news right now is we have progressed through the stages, and we'll be in the next stage probably in a week or two, and leading right to a start in August 1st. So we feel very good about that. But things can change really fast here. Our number one goal will be to make sure that the people that are participating in high school sports and high school football, we have the safest environment possible. And there will be a lot of onus on our schools to help in that, because they are the ones with the facilities, and they have to make sure their facilities are ready, clean, and clean before and after. And so there's a lot of moving parts in returning to play. But we feel we have some good people planning this. We've spent a lot of hours and gotten a lot of input to plan this. But from now, which is June 23rd to August 1st, we could be given some information that could really make us change and force us to be flexible. And we're prepared for that. So we're excited to get our students back on the field, but in the safest way possible. So Darrell, that's all I have. And I do appreciate speaking with everybody today. And it's hopefully going to be a wonderful fall for us as it relates to sports.
Thank you very, very much, Bo. That is the topic that we're all yearning to hear. When can we return to play, and in what fashion and form that we can return to play? And we know here in Ohio, we're in phase 2 right now. So we're excited to see the progression of the game of football from a high school and youth level. So thank you again for taking time to speak with us today. And next up, we will have Coach Kyle. Coach Kyle will be presenting today on proper blocking and tackling techniques. As you all know, Coach Kyle has won 11 Division I state titles as the head coach at St. Ignatius High School in Cleveland, Ohio. He also serves as the Brown Youth Football Advisor and USA Football Master Trainer. So Coach Kyle will take it from here.
All right. Let's see. You got to give me the video. They didn't see me. Here we go. All right. All right. Okay, good evening, everybody. I hope you're enjoying so much information being thrown at you here. My task tonight is to talk about contact, to be very honest with you, contact. And I think as parents, when you talk to other parents, and your concerns too are just in the area of football, there's contact. That's in other sports also. And the important thing is that we're going to try to do this safer. There's been so much research being done in the area of contact. There's other sports that have it, obviously, but football is very visible as far as its contact is concerned. And so there's so much going on to improve the teaching of contact and getting the neurologists and the neurosurgeons involved to make sure that we're doing this the right way. Obviously, okay. Let me do this. Okay, hold it. Okay, hold it. Okay, something. All right. I don't know what happened here. Okay, can you guys see this? I tried to make it bigger. Hold it. There we go. That's about where we're at right now. Let's go to first of all, I'm going to talk about blocking. Now, some of you fathers out there, if you played, say 10 years ago, it's changed. If you did it 20 years ago, it's totally changed. Okay, that's just because of the concussion issues that you've heard earlier, and CTE and so on. Well, that's fine. There's a lot of different research out there that needs to be more involved. Some of it needs way more background to get going. But as far as coaching and football is concerned, we needed to progress and needed to understand that back when you played, I played, if you had your bell rung, you just said, it's no big deal. I'll go right back in. The next day, I felt a little funny, but I'm okay. Well, that's no longer allowed, okay? So our job as coaches is to contact, blocking and tackling, and make it better. That's what we're working on, and that's what we're going to go over. Okay? So here we go. I'm going to start with blocking here first of all. And the guy to your left with the baseball cap on is Scott Peters. He's working with the Browns now. And he and a number of very, very good NFL and college coaches have developed worked on the idea of blocking. And years ago, what I taught, and I've learned a lot in the last 6-7 years, okay? You had to have your butt up in the air, and the lowest man wins, and it was like two rams smashing together. And in all honesty, the biggest, strongest guy probably would win because of just the way the collision was and the mass heading into the block, okay? Well, a lot of physics has been incorporated into the teaching, and that was due, and that was important. So as a parent, you're at a game, and you're looking, and there's your son playing, and the guy going against him is bigger than he. Well, oh no, is that a problem? Well, the way blocking, first of all, in contact is being taught nowadays, to be honest, the young guy who's a little smaller, but if he has better technique, he can do this, and he could do it well. Okay, so I'm moving to this, and this is the point. What's being taught now is force deflection versus horizontal push. For decades and decades and decades, horizontal push was taught. Okay, so some of you dads that have played, you remember maybe the first step hitting, and there was, of course, a drill where the defensive lineman and the offensive lineman went against each other, and there was a crowd of guys around, and they just, okay, it's on 2, and let's see who knocks the guy off the line or something. And you saw two, again, it was like two rams smashing together, and if the one guy pushed the other guy back 2, 3, 4 feet, he wins. The crowd goes, players go crazy. Well, that's the way it was done. Now there's something different, okay? Because they realize horizontal push, one, and let's read through this. Traditionally, both the offensive and defensive players have been taught to strike with their hands and their face mass at the same time in one-on-one contact situations. I coached for years. That's what we were taught. That's where we did it. And the whole change now is occurring with this force deflection. Force deflection works on the premise that force can be generated and control can be established without momentum and helmet-to-helmet contact. So in other words, you really don't have to have the butts up in the air and just smashing together like rams. It's actually most of the force is coming from the power of the hips, okay? And this is what the next thing is talking about. Instead of striking an opponent on the same plane, like two rams smashing together, where the winner is often determined by who's bigger, stronger, and faster, the force deflection offers success through mechanical advantage. So in other words, as you drive your hips and power your hands up, you are actually using your whole body into the block, not just your arms and your upper body. Okay? So the next point is important. Players change the angle of an opponent's spine. Stand them up, taking them from a forward lean to a vertical upright position. Now, you know and I know if somebody is standing straight up, it really doesn't take a whole lot of momentum and a whole lot of strength to push that person back. That's the point here. If a person is crouched down in a classic football position, it's hard to move them. It's because the center of gravity is lower and they have more power because their hips are and thighs and their center of gravity is involved. You stand straight up, you can get pushed over by a 5-year-old if they want to. That's what we're talking about. The idea of who wins the block is not always who's the strongest, who's the biggest, who bench pressed more than anybody else. It's who's technically better in the idea of actually timing up the hit of the hands and the hips at the same time, raising the opponent up. If you are able to get that person, as just we were talking about there, if you're able to do that and raise that person up, they're easily moved, okay, to that upright, from that upright position. Next point, this is achieved by striking opponents with the hands on a low to high plane. On blocking, you're going to keep your arms pretty much at a 90-degree level, but your hands are coming up, and at the same time they're coming up, the hips are actually exploding too. Those of you that have wrestled in the past understand that when you guys understand that, because as you were flipping someone over with a body flip, you were thrusting your hips and using your arms with the same timing. That's what this is all about. So the players change the angle of the spine, stand them up, and taking them from a forward lean to a vertical upright posture. If you get the opponent, I don't care how big he is. That's the whole point of this. It doesn't matter if that person weighs more than you do or is taller than you do. If you're technically timing the hips and the arms up, you'll be able to move that person. And that has been proven. And so that's what's being taught. Now, this is achieved by striking the opponents with the hands in a low, high plane, raising the hips, and this as the sole driving force for power, as opposed to sequentially driving the feet. So, years ago, we used to just have that great one hit, and then we'd say, what? The hips take over the block after the hit. Well, science, physics, a lot of things have been involved in showing that the drive and using the hips at the same time can elevate the person. Then, sure enough, the feet take over the block. But you have to elevate that person first. So that's what's being worked on. It is always easier to push a person backwards when they are standing upright than if they are leaning forward. In the way football is being used right now, if your son, he's just come out of flag football and he's going into rookie tackle. If you notice in rookie tackle, certainly the only lineman that is in a three-point stance is the center. For obvious reasons, he has to snap the ball back. But if you notice, the other linemen are in a low two-point stance. So to teach this this type of deflection, this type of blocking, your son is in a perfect position to learn this. And even if the opponent right across from him is a little bit bigger, if he develops this technique, if he works with this, he'll be able to block him, because it isn't because he's a little stronger than I am or he's a little bigger. It's if my technique is right and I'm using my hips at the same time I'm using my hands, I'll be able to move him. There's a little idiomatic thing here, blast. And what that basically means, because I don't have hours to do this, is basically you start with your base, and your base is like a triangle, so your feet are wider than your shoulders as it comes down. The L there for blast talks about long, and that's important here. Keeping the arms out for blocking at a 90-degree angle. So your face mass, your head is really not involved at all in the blocking here. It's your hips and your arms timed up at the same time. So long means, again, playing long means getting the helmet out of the contact, and it's handled by the hips timed up with the hands, okay? Ascend is the hips timing it up, and again, ascending there and getting to that point where the opponent is elevated. Square, what does that mean? Well, very basically, if I'm blocking someone, I have to have, if you follow this technique, the hips have to be in position angled right at the opponent. You can't block someone with your hands over here. You have to have your hands right in front of you and your hips. So your hips have to be pointed right at the person you're blocking, okay? And if the hips and the hands come at the same time, then you have your square and you have the most power. Now, I don't care how strong that other guy is, you're in control, okay? So that's what square means. Now, triangulate very simply means that do not line up directly in front of the guy. If you look at football nowadays, whether it's the pros, the colleges, high schools, whatever, hardly anybody's really lined up straight over anybody. If they are, I'm talking about linemen now, if they're lined up straight over somebody, they're probably slanting or angling or doing something. Because really what physics has shown us is that if you're slightly off-centered on someone and you attack that half of the opponent, he is not as strong and you can get more control. So triangulate basically means is whatever angle you have, take advantage of that angle because you are much more effective and able to move him as opposed to being what? Straight up on him, okay? So that's taking advantage of the slight angles, making sure you're square attacking it, and using your hips and your arms to deliver the blow and then work your feet. Now, again, this has to be taught to the younger kids, and to me, rookie tackle is perfect in teaching this because, again, the young kids, they do not have the core strength to line up in a three-point stance. Older kids do. But if you have them in a low two-point stance and you're teaching those hands and hips at the same time, you're going to learn some very good blocking. And again, parents, you go to the game and you're looking and the kid going against your son is bigger than he is. If we can coach this correctly, honestly, that's not going to matter because the technique will take him there, okay? Now, obviously, we got to move to tackling. And parents, we could be here for hours talking about blocking and tackling because that's contact. That's where parents are a little concerned about the game of football, obviously. But here's the point. Tackling has changed dramatically. Again, if you played over 10 years ago, you got to go back to school. You got to come to the classes USA Football has, and we have the Browns. We have all sorts of clinics that we do. And we're showing that, wait a minute, it's not the same game when you're tackling. Years ago, you'd stick your nose into the ball and you get, stick your nose in there, get in there. It's different. And what basically is going on now is getting the head out of the way. And how did this develop? Well, this developed with the need to get the head out of the way. And number two, using other sports to get information. For how many years rugby's been going on without any helmets on and equipment, and their ability to get the head out of the way has been important. Talking to neurologists and neurosurgeons, getting the head out of the way, but still having the power and the physical ability to make a good tackle. Now that's been studied, that's been researched, it's going on and on. It's a different game. Trust me, I've been coaching for 40 some years. The last 10 years, the game, as far as contact is concerned, has totally changed. And this is what we're teaching your youth coaches, okay? And that's important. So the point being made, I have this little picture here because I thought I could explain it pretty quickly here. What is very, very important now to understand is the young player needs to have a tackle plan. Well, what does that mean? It means very simply at the snap of the ball, and there's the ball carrier. If I know, I see where he is, at that point, there's no confusion for the tackler. And that's what we as coaches have to teach and communicate. If that person is clearly say to my right side, before he even gets there, I know I'm going to use my right shoulder. I'm going to use my right shoulder. I'm also going to use my right leg. I'm going to team up my right shoulder, my right leg. Thus, I'll keep my head to the left. I already know that. There's no confusion. I'm not trying to slide my head across his body if I don't have to. Because you can have a tackle plan, you can simply be more confident as you come up to make the tackle. This needs to be coached. This needs to be instructed constantly. To be honest with you, every practice, because it's all based on, and the word here on the diagram is very important, it's leverage based, okay? Which in other words, if I'm the left outside backer, I'm going to make most of my tackles tonight with my right shoulder. Because they're going to be attacking me from that side. I already know that. I'm confident of that. Same shoulder, same leg, okay? So if I'm hitting with my right shoulder, my right leg is coming up at the same time. I have way more power there, and my head is out of the way. So that's what we're doing. Defending leverage with our body, defending leverage with our feet. If you look at the pictures here of this really young kid, and these are, let's take a look. On the picture to your left there, the young man's right foot is up. So in that situation, the ball carrier is coming from his right, and he's moving up, and his right shoulder and his right leg are going to be the contact, okay? The second picture has a young man nice and low. He's not standing up, because we learned earlier with even blocking, you can't stand up. You have to have that low football position, the lower center of gravity. You have more control and more power. Notice he has his left foot up. So he is looking thus from a ball carrier that has the ball to his left. He's running up. He plants his foot, shuffles a little bit. He's going to hit with his left shoulder and that left leg coming up. His head is going to be clearly out of the way. And that's what we're trying to do, because let's face it, folks, people are a little worried about football, not because a kid will sprain an ankle, not because they'll get a cut or something like that. It's because they're worried if he has a concussion or a head injury, and they should be, as you heard earlier tonight. They should be, and everybody understands now. It's not, your bell's not going to be, this bell getting rung thing is out. But what we have to do is get the head out of the game, and that's what we're doing. And that's what we're working on. Okay, so certainly understanding, and this is what is being coached to your sons, is there's a sweet spot. Here's the ball carrier. Okay, do you understand where the focus is? Okay. And you're looking at the hip is where the eyes of the tackler should be, not the head, but the hip, because wherever that young man's hip is, that's where he's going to go. And if that young man's coming at us right now, I know what shoulder I'm going to hit him with. I know I may have to kind of move my feet so I can get that leg and my shoulder at the same time. And I know I can make a good, strong tackle with that target area. And as the young man gets older, there's other techniques. As he gets a stronger core, there's other techniques he can use. The thigh and drive, they call it, and the thigh and roll, get the roll tackle. Again, getting the head out of the way, but still being very effective. This is the job of the coach. And what's very important, ladies and gentlemen, is that your coach, if the coach says, hey, I can help out coaching, that's really wonderful. He's volunteering. But if he's just basing on, hey, I played 15, 20 years ago, so I know the game. I'm sorry, that's not good enough. There's classes, there's instruction through the Browns, through USA Football, to make sure that the new nuances and techniques of blocking and tackling, are being taught to the coach, so the coach can bring it to your sons. And that's an important idea. And that's what the Browns are working on. USA Football, your high school coaches, they're all in agreement. We love the game, and this is a game that is very good for your son, very good. So this is what we have to do. All right, I think I'm there, right, Darrell? I think I'm there.
Yes, sir. Thank you very much, Coach Cal. Really appreciate you sharing this great information with us. All right, next up we have Roman Oben. Roman, last but not least, is a special guest speaker for us today. He's the Browns alumni and current Vice President of Football Operations for the NFL. Roman has a unique perspective as he played high school football, college, and in the NFL. He has two sons. One is currently a high school athlete, and the other is a sophomore at Duke University. So you guys help me welcome Roman Oben. All right. So,
Hey, sound check. Can you hear me?
Yes, sir.
Okay, perfect.
Thank you very much.
Perfect. Thanks, Darrell, and I appreciate everyone for staying on. And I know we're we're running up against time a little bit here, so I just wanted to just say a few words, really in support, first of all, of everything that's been said by many of the panelists earlier. When you think about what the challenges are in our game, it's heat acclimatization, it's proper nutrition, it's learning how to tackle, learning how to put on a helmet, put on a shoulder pad. So those are the bigger issues. And I think, as someone who played 12 years in the NFL, like I had to learn what the challenges were and how I could understand them so that I can ensure that my kids had a good experience. And so I think for many of us who I know Darrell played in college and we're the football parents now. And so people are always looking at you for advice or information but I really had to re-educate myself. I grew up in the 80s and obviously, as Coach Kyle said, football was very different back then. And the way it was taught was different. The terminology, the language was different. There's a perception that it could have been a little more, it was a little barbaric to some degree. And just the style of play. So a lot more, double tight ends, a lot more fullbacks and things like that. Now it's more of a space football where defensively you've got to defend the whole field and all those things. But again, when it was time for my kids to come up, I had to learn how to really coach and teach and understand, first of all, a different game. And so, given the negative discussion around the game that started about 10 years ago, 2008, 2009 or so, about concussions and a lot of older players that played a long time ago before a lot of the rules that we have now were put in place. A lot of players were saying that they wish they wouldn't have played or wish they would have known more about the injuries. And so it was really up to me as a personal mission that I didn't want to let the game of football be defined by an injury discussion. And the biggest guinea pigs are our own kids, right? A lot of us want to relive our experiences to our kids, and we want our kids to be certainly smarter than us and make more money and be more educated, but 99% of us want our kids to be better athletes than we were. And so you're talking to someone that didn't really play organized football until 10th grade. And it's not that I'm advocating for playing later by any degree, but it just depends on the kid. And so my focus as a parent was really on athlete development, playing multiple sports. There's things that you can use in different sports. When Coach Kyle put up that diagram of a batter at the plate, or you talk about that hip development, I talk to my kids a lot about being strong at that athletic position. So if you're a linebacker, a running back about to take a handoff, a point guard, if you have a tennis racket in your hand, if you're a pitcher, it's about being strong in that athletic position. And then those athletic positions are developed by playing different sports. So when you talk about my kids, they played soccer. Everyone plays soccer, t-ball, wrestling. I'm a big proponent of running track. I think everyone needs to learn how to run. It was surprising to me that the average kid, when I started doing camps and clinics, they just didn't know how to skip. Just learning how to just do an athletic A skip was something that was really a lost art. And so those are the things that I focused on. So my whole selfish nature and ambition of wanting to get into this business of the youth sports business, the the youth football business, the sports enrichment business was really selfishly about how could I be a better parent and really teach this game to my own kids and just understand athletically where things were going. So I read a lot of books on athletic movement and things like that. But I think at the end of the day, for me, it was about just being a parent first and just being as much, just getting as much education as I possibly. My home phone never rings until I get on a Zoom call. So I apologize for that. But it's just, as a parent, it's about being educated. You just have to be as educated as possible. And so I appreciate, again, the panelists for some of the things that they shared. So I wanted to share, one major point here. I know Darrell's gonna ask me a few questions, but I think at the league office, in a way that we wanted to really introduce the new youth strategy, going back a few years, and we worked with USA Football, worked with Coach Kyle and some of the folks. So all of you parents really in Northern Ohio, the Cleveland metropolitan area, are really fortunate to have people like Darrell and even Jenner, who really care about the community and the things that the Browns have done. Donating turf fields and getting people like Coach Kyle on board as an advisor, using a lot of former players, a lot of former Browns like myself to really impact the community. That's really tremendous. So Darrell talked about my first son, who was actually born at the Cleveland Clinic in 2001, right before the season. So RJ he's going to be a sophomore at Duke, and then I have a son, my second son. I left the Browns, went to the Buccaneers. The next year, won the Super Bowl on Gruden's team, and my next son was born in Tampa. So I'll always appreciate my time in Cleveland and my time in that community, and I always, secretly root for the Browns to get back to the prominence that I remember as a kid. So the three things I wanted to talk about when you talk about youth development, and when you speak from a standpoint of a parent, there's three phases. So there's the youth phase, where as a parent, you need to just grab as much education as possible. So there's a feeling of making sure your kid is safe, making sure you're educated on nutrition, stretching, heat acclimatization, all those things. No sugary snacks. It's certainly not when it's in the heat in summer months. An introduction to the game. Flag is football. We've seen participation shift a little bit. But at the younger ages, we want kids playing football in any form. We want girls playing. We want boys playing. We don't want to. We want to eliminate any barrier to entry. So there's the youth portion, ages 6 to 11. So that's introduction, adoption, and just an education about the game. Middle school is really when things start to get competitive. So now you're at puberty ages, like 12 to 15. 7th. 6th grade to 8th grade, around that time frame. So now it's more about competition, character, introduction of character values. Kids want to play football. So whereas the child of a 6-year-old may have anxiety, should I play tackle? Should I not? Should I wait? But when you're talking about now 6th, 7th grade, it's about being competitive, and it's about wanting to play the game. And this wasn't discussed as much tonight, but then you can talk about strength training, for example. How do you now protect your body for the type of movements that you're going to be able to do on the football field? So with strength training, and then kids that play different sports, they may start to gravitate towards a specific sport or two, because you're now getting into preparation for high school. So as I always tell my sons, wherever you are, you're always preparing yourself for the next step, and then you're learning about yourself through the process, and you're kind of understanding what's needed at the next step. And God bless size and speed and all that, and whatever you can get from your parents. But I always say there's advantages for being a smaller kid because you're shiftier and maybe you develop some muscles earlier. And sometimes there's advantage for being a bigger kid because you may be a little bit lanky and uncoordinated when you're younger, but you kind of catch up as you get older. So it's always about athlete development. So youth, introduction, safety, adoption to the game. Middle school, more competitive character, strength training. And then obviously high school. High school is when you're talking about your elite level competition, anything that's more college facing. The camps and clinics are more competitive. You want a scholarship, you want to play at the next level, whatever level you can play. And then now you're talking about maximizing your speed. And then there are defined winners and losers where, sort of where people say everyone doesn't get a trophy. So I think when you look at yourself as a parent, wherever you are in that continuum in terms of you have a youth, a middle school, or a high school kid, just make sure that you start to mature and understand where you are at that phase. Every 6-year-old wants to be 10 years old. Every 10 years old wants to be a teenager, and teenagers obviously want to be adults. But I think we can never lose the where we are in that process about what our kids need at that phase. So when you talk about the medical discussion, is different for a 6-year-old than a high school kid. You know, when high school, you start talking about steroids and performance substances and supplements, and that's a mature discussion. So those are things you need to just prepare yourself. And just quickly, obviously, you know, my two sons, I'm really proud of them, and what I'm the most proud of is not where they ended their journey or where they might play, but it's about that they developed their own love for the game. So as a parent, you know, don't screw it up and take your own kids' joy away from the game and just joy from competing. And the beauty of football, and Coach Kyle could attest to this, is, you know, many other sports, while football, the game of football was taking a lot of criticism about head, neck injuries and all those things, we're also learning, and we had to learn a lot quicker how to change things, how to change rules, how to change tackling rules. And then other sports mirrored what football did. And this isn't a concussion discussion about which sports have more concussions in football, and it's not about that, but it's about really being proud that sometimes in the face of criticism, the game of football, from the National Football League, college, all the way down, has really had to make adjustments earlier than other sports had to. So when soccer started getting rid of heading under a certain age, that was because football changed. When other sports started making different rules, you know, hard fouls in basketball, that's because football changed it first. So I'm always appreciative where football is really led in the charge of educating people, doing better to educate ourselves, and then making sure we actually have a game. I think the game is a lot more of an athletic game than it was when I was a kid and in high school, and it'll be even more athletic as, you know, 20 years from now. So I'll end there, but again, you know, my role at the National Football League is definitely complex, but, you know, I love working with Darrell and Jenner and, you know, the Brown staff, Coach Kyle. I love, you know, understanding what's going on around the country in different parts of the country, and also I love just solving challenges. You know, how do we make this game a great game, and then we have a great experience, obviously for ourselves as parents, and then for our children, boys and girls, that they may have the best experience. So. I didn't have a slideshow to share with you, but I just wanted to just have an honest, just more of a testimonial, parents first perspective. And as someone who has children, played the game at a high level, and now I'm an administrator in the sport, and still have to, you know, teach other kids and other parents as well. So thank you for that, and I hope I just try to catch up on the time. I know we're running, but any questions or anything, Darrell, you may have for me, I'd be happy to ask.
Yeah, I have a couple questions for you. Thank you very much, first of all, for the personal testimony about the game of football. So the first question, speaking of your role in with the NFL, what is the most difficult part about your role in the NFL?
I think the most difficult part is just understanding that there's just a lot of different challenges. You know, when you talk about the state of Ohio, we research participation around the country. Ohio was losing, you know, 10% of the population, you know, every decade in the census. So that affected males, that affected how many males played high school football, that affected, you know, people moving down south, warmer weather. So where you saw where football is growing in one part of the country, you saw where football is dropping at certain ages in certain parts of the country. But so understanding that and trying to boil it down to educate people on that is because you're literally having 30 different discussions around the country. And so that's the biggest challenge, really trying to understand what's the issue. You go to Houston, Texas, for example, where you have you know, obviously a growing Hispanic or Latin population. You have the first generation that has to teach the game to their parents, and not the other way around. So when you talk about the loss of baseball affinity in America, parents weren't teaching the kids the baseball. The kids didn't see the path of baseball as much as they did 30, 40 years ago. You have a sport now with the, you know, the Latin American community that's the kid is teaching the parent the game because the parent doesn't understand the game. So there's different issues and different challenges, but the most rewarding is I get to meet really cool people that are doing great work in their communities, like yourself, again, Coach Kyle, Jenner, you know, Katie, the nutritionist, and, you know, I'm going to need some nutritional advice here as a former lineman. I want to get down to Joe Thomas size. He lost a lot of weight, so I'll get some nutritional advice there. But it's been great. I really appreciate my time and how I've been able to serve.
Absolutely. One additional question for you before we start our panel discussion. We'll have a brief panel discussion. I know we're at 8 o'clock, but we'll stay on for a couple more minutes. We're recording today's session as well, so if you have to log off, please see this video on clevelandbrowns.com within the next few days. Quick question for you. What are some challenges you've seen around the country as it relates to COVID-19 return to play protocols?
Well, it's the bigger challenges I would see just around the country is really how does heat acclimatization play into how high school seasons determined. So when you talk about the southern belts of the United States, if you play football in Florida or Texas, you could probably play 14, 16 games before you get to the state championships, which is well into December. Up north, Ohio, Illinois, it's different. You know, you've got to be done pretty much by Thanksgiving. So if you talk about a potential shortened season, you talk about some parts of the country, let's say, Minneapolis area, Minnesota, like that part of up north, it's really cold. So you're talking 5-6 game seasons potentially, and starting the playoffs sooner. And so those are the challenges there. And then one thing that we didn't mention, helmet reconditioning. Helmet reconditioning was potentially a challenge because the factories were closed. Riddell, who reconditions probably 70% of helmets in the country, that's NFL, college, high school, about 1.1 million helmets. There was some challenge there, but I think now because things are opening, they're double and triple shifting to make sure that people have the proper helmets and the proper equipment. The last part of that is officiating. Because of COVID-19, and maybe Coach Bo Ray could weigh in here from Ohio State Association standpoint. There was a general concern that the aging official, you'd see a drop because of the age and because of the health risks and not wanting to go through this officiating certification and training because of the time and obviously the virus, potentially people having anxiety about returning back to a sideline or a field. So it's different challenges around the country again, and trying to capture all that in a way that I can educate myself better and I can educate all the NFL teams better. But those are just a few of the things that we saw. So I live in New Jersey, and we were at one point 50% of the death toll in the cases in the country were just in New York, New Jersey alone. So we're now, phase 2 with businesses and football. I think we'll start training outside in July 13th. But again, you want to catch any of these cases early, and then so that hopefully by August 1st, we can prepare for, a Friday night, September 4th or 5th start of the season.
Absolutely.
So thank you for asking those questions.
Yes, sir. Thank you very much. And now we'll transition to our brief panel discussion. So we'll have Coach Kyle, Bo Rugg from OHSA, Katie Messick, Dr. Bailey, and Dr. Cup. We'll sign on momentarily. Please send us any questions that you may have for our panelists, and we'll get started here quickly. Dr. Bailey, this was a question that came in regards to helmets. Are there any good helmets that you would recommend from a concussion standpoint?
Well, the NFL has actually led a lot of the research in helmets over the last few years. I would say that, even just a few years ago, I would have told you that the answer really isn't helmets when it comes to concussion management. And I still don't think it's probably the silver bullet. And I think probably more along the lines of what Coach Kyle has talked about is probably among the more important parts, and that is the proper technique and tackling is going to be where things are going to be at. However, the NFL actually released some data here in the last year or two, kind of looking at what helmets seem to be doing well for the NFL and which ones don't. The problem is that's not really, we don't know that really applies necessarily to the high school and younger athletes. So there's still a good bit of research that's going on. Some of those helmets get real expensive real quick. And so trying to figure out how much is really worth that versus not is a difficult question to answer. Like I said, I think that the NFL's data has actually really done a great job where they actually, with each injury, they can actually kind of map it out, and they have people that are actually doing all kinds of modeling, and they can show it from all angles and really look to see what's going on. And in doing that, they found that there really are some differences that are out there. But again, we're just not sure whether or not it really applies to the people that are younger.
Got it. Thank you very much. Katie, how do you think athletes and parents can best work together to help assure a healthy diet? Because I know a lot of kids, they just want to go to McDonald's before the game or after the game because their metabolism is fast. So how do we get parents to kind of budge a little bit, kids to budge a little bit to get the right diet?
That's a great question, and there's always room for everything. It's just where and when. But I think getting the children involved in the grocery shopping, doing some simple cutting during the meal prep time, having them kind of plan out the meals, and just getting really the kids involved in the meal making process or in the meal planning process really kind of helps them buy in as well.
Awesome. We'll definitely have to take that advice. Roman asked for some advice early as well, so we'll have to. Awesome. So, Bo, this question came in for you. The question was about high school football teams traveling out of state this year. Will this be allowed or not allowed?
Sorry, I had to unmute. Well, currently, we are going to allow it. And we have several schools, a lot of our schools that have contracts. And you have to remember that we have a lot of schools on the border in Pennsylvania, West Virginia, Indiana, even some in Kentucky that may be even in leagues that are playing out of state. So it would really be hard for us to say no. But I think travel is one of those things that could change as far as distance. We will have teams, especially good teams, that will travel as far as Las Vegas or Washington, D.C., Atlanta to play games. And some of those long travel type games, I can see that being restricted. Currently, we have no restrictions, but that's something that could change as far as the distance is concerned.
Got it. Thank you very much. Dr. Cupp, this was a question came in from a parent. I've definitely witnessed this as well. So with kids playing youth football game, you may have a brother who plays at 8 a.m. and then you don't play until 1 p.m. on Saturday. So how early should a kid go to the game in preparation in regards to a heat and hydration standpoint?
Gosh, I wish I had just one simple answer for that. That gets tricky, and it's going to be a case-by-case situation. But if you're the only transportation and you got to take both of them at the same time so they can both play, then you're going to have to plan ahead, and you're going to have to carry plenty of water with you. What you don't want is the kid who's playing second to kind of be messing around and running around and not paying attention during the first game and drinking all their water at that time, and then peeing it all out, and then not having anything for the hour or two before their game. So take the recommendations that I shared and that Katie added, and try to plan your day accordingly.
Thank you. Coach Kyle, this question was, how would you approach a coach that is putting your child or another child at risk by putting winning ahead of safety?
Okay, well, first of all, there's an important question that the parent should ask as they enter the football program. First of all, are all the coaches certified through USA Football, certified that they've had classes and instruction on what coaching really is about? And that, first of all, could probably negate some of the problems. Because if the coach is just saying, hey, I played 15, 20 years ago, hey, I'm volunteering my time, I know the game, I know what to do, it's a changed game. We've talked about that, and Roman's talked about it. Everybody has talked about that. It's changed. And That needs to be asked first. Now, if there's a situation where here's a coach that clearly he's worried about his record, there's no problem with the parent walking up and going, look, my son's in this game, in this program, because I want him to learn how to work with other people, and I want him to be in something that challenges him physically, mentally. A lot of things happening in the world nowadays where a kid just sits on a couch and looks at his phone. No, football gives him that amazing opportunity to learn how to work with other people and learn that's the real motive. You look to your left, you look to your right, and you don't let those people down. You just battle it out even though you feel weak. But, Coach, come on. If you're just worried about your record, you're not teaching these young kids anything. And a clear conversation, and it doesn't have to be heated. Honestly, parents need to go timeout. Don't approach the coach right after the game. Please don't do that because there's too much emotion. A day later, 2 days later, an email just going, look, can we talk? Because this is what I'm observing. Everything settles down by that time, and a good conversation going, look, as a parent, this is what we're seeing. And, come on, parents talk to other parents. This is what we're seeing. And then every school has an athletic director, whether it's youth, he's the commissioner, so on. Those commissioners have to see that. They have to see that the values here are not about your record. It's about the amazing ability to teach young people. Everybody in this panel knows darn well, I'm an English teacher. You don't remember your 4th grade English teacher. I'm sorry you don't. You probably don't remember your sophomore English teacher, me. But you know whom you remember? You remember your youth football coach. You remember that man's name, and he's important to you.
Awesome. Absolutely, Coach. So we have time for 2 more questions. We have one that came in for Roman and then one for Dr. Bailey. Roman, in regards to, we have a parent who has interest in their kid continuing to play flag football beyond 2nd, 3rd grade. What is the NFL's take on flag football as you get older, rather than playing tackle until the parent's comfortable?
Well, I think it's really about the kids' comfort zone, their appetite, and the availability. I think some communities don't offer flag, and you may have to travel or drive 20 minutes, and that goes back to the parent schedule, the work schedule, and all that. And so I think football is football. I think if you have a football in your hand and you're experiencing, route combinations and catching a touchdown and scoring, and Coach Kyle knows this, it's a lot harder to run and decelerate and grab a flag than it is to run and tackle someone. That's harder to do. Now, I love high school tackle football, and I think it's a size, weight, speed thing at a certain level when you get to a certain level of football. But I support kids playing flag. There's a discussion about flag, being in the Olympics in 2028. It's probably going to be a demonstration sport next year at the World Games. I think the next demonstration sports, I think it's flag, wrestling, and lacrosse. They're trying to make I think female wrestling, the Greco-Roman wrestling, obviously. But I think from what I've heard, that flag would make a case. But again, there's the athletic part of the game, and I think that's what's promoting flag to advance. And then there's the part of it that at some point kids become more mature. You are just seeing kids play tackle later. You are, and because of the football part of it is more athletic and more space, so flag actually segues into tackle really well. I know a lot of youth kids that play tackle and they just play flag in the spring, or kids that'll play flag until their parents are comfortable, and then maybe they want to play tackle, or maybe they don't. Maybe they want to play video games, and they're all kids, and they just want to make sure they have a good experience. So I would support anything that a kid wants to do.
Absolutely. Thank you. And then Dr. Bailey, you got the $1 million questions. Are sports, and football in particular, worth the risk? And if so, why?
Well, that is the $1 million question, right? So, I tell you, the team sports in general, I feel like are extremely important part of a child's development. It's something that I really encourage in my own kids. And football and contact sports, I think that the science that has been done so far is something that's helping the game. With things like rule changes that move it up, that move the kickoff line up. So like dramatic improvements in the number of concussions that were occurring, even with a kind of minor rule change like that. There's the studies that are being done on the helmets. Again, the information again that Coach Powell talked about. I think the game is safer now than it's ever been, truthfully. And I feel like that. I've got 3 girls, so I don't have somebody who's going to be playing football probably. But I do let them play. I let them play soccer, and and women's soccer is the highest base rate sport for women. So again, if I had a son, I'd let him play football, and I wouldn't have any concerns. If he had a concussion, I wouldn't treat it. I'd make sure that he was managed well, and you make sure that they do what they need to do to rest and recover afterwards. But I'd let my kids play.
Awesome. Thank you very much, Dr. Bailey. And thank you, Roman, Katie, Dr. Bailey again, Bo, Coach Kyle, and Dr. and Coach Sean Cupp. Really appreciate you taking your time today to continue to give us knowledge in regards to the health and safety of these youth athletes. And parents, we also want to thank you for attending the 2020 Cleveland Browns Parents Clinic. Make sure that your kids' coaches have their USA Football Youth Coach certification. USA Football has agreed to pay for the first 1,500 coaches to receive their youth coach certification for free. For more details, you can visit clevelandbrowns.com. Again, we'd like to thank you for joining us tonight, and good luck this year. Thank you, guys.